Hi everyone, welcome to our video today. My name is Brooke and I'm a part of the Invizi and Undies team. And today we'll be having a chat with the lovely Rachel, who is a continence nurse. So the video is going to be focused around some of the questions that came through in relation to childhood incontinence and bladder leaks and other bladder health queries that we may have had. So we're going to start off with our first question today, which is, I have a neurodiverse 7-year-old. He is still in nappies full time. All the usual training has failed. He is unable to register when his bladder is full and doesn't know how to urinate. I've taught him how to recognize these feelings. We've tried tone schedules, sticker charts, no undies and no nappies, undies under nappies, reading books, etc. I am at a loss as to what to do to assist that is neuroaffirming and understanding. Perhaps he just doesn't have the skills yet. I would like to teach them, but how do I go about it?
It's a big question, and it is a really wonderful space that occupational therapists work in as well. And if you can find one who specializes in pediatrics and bowel and bladder, but also really understands the concept of interoception, that's the support that you need. So interoception is that message that our body is giving us that it needs something. So if we're thirsty, we know we need to go and get a drink of water. If our bladder is full, we go, oh, yep, I need to go to the toilet. If our bowel is full, we understand what that means. If we're hot, we'll, take a jumper off, that sort of thing. Children with neurodiversity or individuals with neurodiversity, often they have this thing I'll call a busy brain, where those messages just get lost, and it's very difficult to for that message to get through and the appropriate highway for them to work on it. So, excuse me, having an occupational therapist who really understands how to quieten everything around the child and then to slowly work a little bit at a time on helping them to be aware of what those messages are. Now, they're the ones that have the clever tips and tricks and the activities and the exercises that help to engage their brain and their body in the right way. So that I would suggest heading in that direction. There's a website called the Eric Foundation, and it's UK based, and they have a really wonderful web page filled with information on interoception and helping to support children with bowel and bladder issues. So that's ERIC, the Eric website, the Children's Bowel and Bladder Charity in the UK. So that's a really wonderful resource. So I would say head there. Maybe take a step back and do some more reading, talk to some occupational therapists who are really brilliant with this sort of thing. There are continence consultant nurses. I know of one in particular who lives in New South Wales in Australia, in Sydney, and her primary work is with children and children with these types of disabilities as well. And she's really very wonderful at helping teaching carers and parents how to help these kids as well. What I find with children, without giving very specific advice, with children that are living with these kind of symptoms, is that it's very much about learning who the child is first, and then learning what's going on around their life and what's going on in their body, and then taking a step back and trying to work out what's the most helpful thing that we can do at this point in time, rather than having a formula that we approach the situation with. With children, it takes a bit longer because they can't tell you exactly what's going on like adults can. It takes you actually getting to know them before you can give specific advice. So see a paediatric continence specialist. There's the Paws Clinic at Westmead, paediatric at Westmead Continence Specialist Clinic. That's a great place to link into as well. You'll need a GP referral, but that's a great place for children who've got these sorts of symptoms as well.
Awesome. And we'll add those links in the description of the video below so that everyone has those resources available to them. So our next question is, my son has SEN and we are potty training. He has got the weeing, just not the poo. We have been going with this for months. Now, what can I do to help him get past the barriers to pooing on the toilet?
Yeah, so SEN, I'm assuming, is a special education needs.
Yeah.
Not quite sure how old this child is, but it's not uncommon for the bladder to be trained first and then the bowel continence comes later. That's normal. Quite often, a part of the story is that the child's had a history of constipation. What happens with children is that they have an uncomfortable or painful experience with passing a bowel motion, and then they tend to withhold because they don't want it to happen again. And then their bowel just gets drier and harder the longer the food stays in there, and it gets compounded. And you know, before you know it, months have gone by, and it's been really difficult to get them to pass a bowel motion. And you find that they're just sitting in a nappy, and that's how it's done. So working with a really good therapist to have a look at everything that's going on, what the nutrition is like, what the fluid intake is like, what the bowel like the regularity and the habits are, how frequently they're going. Making use of the gastrocolic reflex as well is a really important thing to be doing in this time of toilet training as well. So just get some resources, have some conversations with people, and be patient. Be patient with the child. Chastising doesn't help at all. Using rewards can be helpful, but understanding how the child works and what is their value system can be really beneficial in inspiring them to meet some of those milestones as well.
So our next question is, my 15-year-old is still not dry at night. He's on medication, but doesn't seem to make a difference. How can I help a child in his teens, and is it okay for an older child to be in nappies?
Sure, that's a tricky age to be going through this sort of thing. And not being dry at night specifically, that might have something to do with what happens while he's asleep. So if you've got a 15-year-old who is very active on their iPhone or their laptop or the blue light screens, those sorts of things, it can disrupt the sleep hygiene. When you've got poor sleep hygiene, you have compounded fatigue. The brain doesn't work in the way that we'd like it to when you're resting. And sometimes the patterns of sleep can change, and that actually disrupts what's happening with your bladder in the night as well, and the hormones that are made to help your bladder be calm and perform the right way. So things that you can do, take him to see a continence nurse and have a chat about what's happening in his life. Sometimes psychosocial issues can actually play a role in what's going on with bladder incontinence. There's a series of questions that can be asked, and a lot of things that can be tried and looked into, but at the end of the day, every now and again, there's incontinence and it's idiopathic and we don't know why. And there's nothing we can do about it. We've tried everything, so it's about using a really good incontinence pad that fits. So 15 years of age, you can get that funny gap of the pads that are too small and they're way too big for adults, too small because they're for kids. So it's just finding a product that's right for that capacity that he's weeing out, but also that will fit his body appropriately so he won't leak. So a pad's good. And sometimes teenagers, they just wake up and they grow out of it. You know, the next day they'll be dry and they're never wet again. Sometimes that happens. So it's a matter of understanding the issues and what can be done to try and get to the best place, and then also being patient as well.
All right. And then our final question for our video is, my daughter has seizures and her bladder is out of control. Is there anything I can do to help?
Yeah, this is a tricky one. So incontinence and seizures, it's hard because you're disrupting the neural pathway during the seizure. So the messages that tell the bladder to stay calm or not contract or to contract, they're different at that point in time. Some medications that are taken for epilepsy can also make incontinence worse. So that's an important conversation to have as well. 39% of people with epilepsy will have at least one urinary symptom. And quite often that's just losing control of the bladder when you have one of those large tonic-clonic seizures. They may even have fecal incontinence as well when they have a seizure. So really the best thing is about making sure that the conservative habits are the best they can be. So appropriate hydration, the bowel is taken care of, good fluid intake, good food intake, and fitness is good. We're minimizing the risk of obesity, all of those sorts of things that really contribute to having incontinence anyway. Work with your epilepsy specialist, and have a chat about the medication that they're on, and then find yourself some really good pads, and look after the skin as well. Yeah.
All right, and those are all of the questions that have been sent through and that we'll be going over today. So thank you again to Rachel for coming along and helping us give some amazing advice and for all of your knowledge in regards to these questions. And thank you to anyone that has sent any questions through. And we really appreciate you all tuning in, and we'll see you soon. All right, see ya.